Okay. Hello, everyone. Welcome to week 7 of our LAM CAA assessment. This time we focus on the gastrointestinal system. We will discuss the 4 C's, 5 command points, and the extra points. Let's start the ball rolling with the first participant, Ma'am Angel. Ma'am Angel, good evening.
Good evening, Doc. Good evening, classmate po.
Which number indicates the transverse colon?
Number 8 po, Doc.
Number 3 is pointing to.
The submandibular salivary gland.
Number 1 is pointing to.
The oral cavity po.
Which number indicates the sublingual salivary gland?
Number 2 po, Doc.
Which number indicates the cecum?
Number 10 po.
Number 11 is pointing to.
The appendix po.
Which number indicates the liver?
Number 4 po.
Number 5 is pointing to.
The gallbladder po.
Which number indicates the duodenum?
Number 6 po.
Number 13 is pointing to.
The nasopharynx po.
Peristalsis causes what?
Food to move down the esophagus.
Number 7 is pointing to.
The common bile duct
Number 9.
is pointing to ascending colon po.
Which number indicates the parotid salivary gland?
Okay. So number 12 po, Doc.
True or false? Digestion begins with saliva and mastication.
True po, Doc.
Number 11 is pointing to.
The appendix po.
Which number indicates the tongue?
Number 14 po.
Number 15 is pointing to.
Laryngopharynx po.
True or false? Peristalsis is the proper name for chewing.
False po, Doc.
Which number indicates the esophagus?
Number 16 po.
Number 17 is pointing to.
The stomach po.
Number 13 is pointing to.
The nasopharynx po.
Water and minerals are reabsorbed into the blood in.
The large intestine po.
Which number indicates the pancreas?
Number 18 po.
Number 19 is pointing to.
The pancreatic duct po.
Which number indicates the parotid salivary gland?
Number 12 po, Doc.
Which number indicates the small intestine?
Number 20 po.
Number 23 is pointing to.
The anus po.
Number 21 is pointing to.
The descending colon po.
Which number indicates the rectum?
Number 22 po.
What is number 14 pointing to?
The tongue po.
Now, 95% of absorption of nutrients occurs in.
The small intestine po.
What is number 12 pointing to?
The parotid salivary gland po.
True or false? Mastication is the proper name for chewing.
True po.
What is number 10 pointing to?
The cecum.
The oral cavity is indicated by number.
Number 1 po.
What is number 2 pointing to?
The sublingual salivary gland.
The appendix is indicated by number.
Number 11 po.
The submandibular salivary gland is indicated by number.
Number 3 po.
What is number 4 pointing to?
The liver po.
The ascending colon is indicated by number.
Number 9 po.
What is number 12 pointing to?
The parotid salivary gland.
What is number 8 pointing to?
The transverse colon po.
The gallbladder is indicated by number.
Number 5 po.
What is number 6 pointing to?
The duodenum po.
The common bile duct is indicated by number.
Number 7 po.
Thank you very much. Congratulations. Perfect score. Keep up the good work.
Thank you.
In case may mga comments, no, let us know. Sometimes, yeah, we give the wrong answer. Now let's go to Ma'am Ami Glorioso. Ma'am Ami, good evening.
Good evening, Doc. Good evening, classmate.
What is number 14 pointing to?
Pointing to tongue.
The pancreatic duct is indicated by number.
19.
The laryngopharynx is indicated by number.
15,
The anus is indicated by number.
23,
What is number 16 pointing to?
esophagus,
The nasopharynx is indicated by number.
13,
The stomach is indicated by number.
17,
What is number 18?
pancreas,
The pyloric sphincter controls the flow of chyme into the.
duodenum,
What is number 20 pointing to?
small intestine,
The descending colon is indicated by number.
21,
What is number 22 pointing to?
rectum,
The thick liquid in the stomach after digestion is called.
chyme,
True or false? The stomach contains hydrochloric acid.
true,
What is number 12 pointing to?
carotid salivary gland,
Now let's go to physiology. Saliva contains the enzyme amylase, which breaks down which compound?
starch,
The gallbladder releases which substance?
bile,
At what pH range is gastric acid maintained?
1 to 3,
Okay, what do we mean by pH? It's a degree of acidity or alkalinity. Ano po yung normal pH?
normal
Neutral
pH,
I'm sorry, what is the normal pH of blood? Okay, the neutral pH is 7. But my question is, what is the normal pH of blood?
pH of blood number,
Okay, you researched that.
yes,
Mali din yung sasabihin ko, 7.4.
okay,
It's strictly alkaline. Okay? But the neutral pH is 7. I'm sure everyone has science subject. Yeah, chemistry, no? Okay, so at what pH range is gastric acid maintained? So answer nyo po is 1 to 3, right?
yes po.
So bakit hindi natutunaw yung ating gastric mucosa?
Magkaroon po ng pamamaga.
Yang yan, hindi. Diba, pag nilagay 1, 2, 3, very ano yan. Did you ever ask yourself, bakit hindi natutunaw ating ano? So itanong nyo po yan sa inyong practical. Or you try to look for the answer. Did you ba? 1 to 3, that's actually very acidic. Pero why is it that hindi nasusunog yung ating tiyan? So there must be something there, right?
Yes.
Okay.
Sa mucosa.
Yeah. Meron siyang
Mucus, nakapal.
yeah, okay, whatever.
May
Mamaya.
buffer.
Now you know. But there are people na talagang nabubutas yan. Okay? So you need to do something about it. Okay, so these things are very, very important, especially if we endeavor to become a very good practitioner. Number 4, what is the name of the muscular process for moving food down the esophagus?
Peristalsis.
Okay, I have a question. Kung upside down ka, yung ulo mo nasa floor, will you be able to swallow food?
Hindi po kasi nasa taas. Kailangan po pababa siya.
Are you sure? Have you ever tried doing it? Is this the reason why we have peristalsis?
Big down po eh.
Okay, it will move the food down. It doesn't have. Okay, research nyo yan. Did you ever ask yourself, try nyo daw kumain na balik, upside down? Okay, that's the reason why we have peristalsis. Okay. Where does the absorption of water occur?
In the large intestine.
Which one of the following is not a function of bile?
Breakdown of protein.
Proteins are degraded by which enzyme?
Pepsin.
Where in the gastrointestinal tract does pancreatic juice drain in?
At the small intestine.
Which part of the villus is used for the absorption of fatty acids from food?
Lacteal.
Which of the following is not a product of fat digestion?
Peptides.
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 Lipase or lipase degrades which group of compounds?
Fats.
Where does protein degradation take place?
Stomach.
The blood capillaries in villi absorb which nutrients?
Simple sugar and amino acids.
Which of the following is not an advantage of stomach acid?
pH for amylase.
What is the esophagus made of?
Smooth muscles.
The duodenum is part of which of the following? The duodenum is part of which of the following?
SI.
Okay, what are the three parts of the SI?
Jejunum and ileum.
Name the contractions that push food through the esophagus.
Esophagus. Peristalsis.
Peristalsis.
Yan.
What type of acid is found in the stomach?
Hydrochloric acid.
Where is bile made?
From the liver.
What role does the pancreas play in the digestive system?
The productions of digestive enzymes.
Which of these is an accessory organ to digestion?
Gallbladder.
How often does the stomach need to regenerate a new layer of mucus?
Every 2 weeks.
Okay. This is the reason why hindi tayo kailangan kasi ng ganung pH para malusaw mo yung kinakain mo, 'di ba? Every 2 weeks you need to regenerate a new layer of mucus. The wall of the intestinal villi is approximately blank thick.
1 cell.
The lacteals in villi drain into which system?
Lymphatic system.
What is a bolus?
A bowl of masticated food.
The glands that produce amylase are in the
Mouth.
which part of the body performs mastication?
Mouth.
The stomach is rich in folds called.
Rugae.
Where does the descending colon lead to?
At the rectum.
What purpose does the invagination of the intestinal wall serve?
To increase the surface area for absorption.
Thank you very much, Ma'am Ami. Very good. Excellent job.
Thank you.
Yeah, thank you po. Keep up the good
Thank you
work.
po.
Now let's call on Ma'am Lynn Galarita. Good evening, Ma'am Lynn. Pathology na tayo. Are you there, Ma'am Lynn? Hello? Wala yata si Ma'am Lynn. I think nawala siya. Okay, can we call on... Okay, na-disconnect daw siya. Bakit hindi na-disconnect?
Ako na. Me?
Ano yan, may party? Okay. Can I call on Ma'am Cheryl Bahamundi? Good evening po.
Good evening, Doc.
Good evening, how are you? Are you ready?
I'm good. How are you?
Can
I
you...
will try.
Okay, take care of pathology 1, 2, and 3. Very easy. Very, very clinical. A low fiber diet can cause or exacerbate
Constipation.
Yes. A sore on the mucous membrane of the oral cavity is commonly known as.
The mouth ulcer.
What is the most common cause of diarrhea?
An intestinal infection.
A hiatus hernia is the protrusion of which of the following into the thorax?
The lower part of the stomach. Hello.
Yeah. Are you sure of your answer?
Hiatus hernia. Hiatus hernia. Yes. Oh, maybe the upper part. The upper part of the stomach. Hiatus. It's into the diaphragm.
So upper part, not the lower part.
The upper part of the stomach.
Kasi chest cavity pa rin.
Opo. Yeah. Going up.
Oh, lower part.
Lower part. Into the thorax. So going up.
The upper part.
Upper part. No.
Okay, upper part.
Upper part.
Magkaan? Okay, just let us know, huh? Okay, who has, okay, what? Anyway,
Lactose intolerance.
lactose intolerance is inability of adults or children to digest a particular type of sugar found in.
Milk. Lactose.
Where would a gastric ulcer be found?
Gastric ulcer would be in the stomach.
A yellowish discoloration of the skin and the white area of the eyes is the main symptom of which of the following?
Jaundice.
Jaundice is caused by a high blood level of which of the following?
Bilirubin.
Crohn's disease is a type of.
I think it's an inflammatory bowel disease.
Phenylketonuria, which involves an impaired metabolism of phenylalanine caused by.
A lack of the pH enzyme activity.
Appendicitis is.
An inflammation of the appendix.
Inflammation of the pancreas due to prolonged heavy alcohol use is referred to as.
Alcoholic pancreatitis.
Is there such thing?
Or maybe chronic? No.
Alcoholic. Chronic
It's
pancreatitis.
maybe it's chronic.
Chronic.
Pero I have
What is eructation?
It's belching.
Which of the following is the name of a digestive disease in which pouches within the large bowel will become inflamed?
Diverticulitis.
Prolonged straining in an effort to empty the bowels can lead to which of the following?
Hemorrhoids.
What is the medical name for the condition of impaired digestion commonly known as indigestion?
Dyspepsia.
Which condition is characterized by replacement of normal liver tissue by scar tissue, resulting in a loss of liver function?
Cirrhosis.
Is this reversible or irreversible?
I think it's irreversible.
Irreversible. What is the prelude to cirrhosis na medyo reversible pa? It's called steatosis.
Hepatitis.
No. Fatty liver.
Fatty.
Kaya
Thank
yung
you,
mga fatty liver dyan, may pag-asa pa. You just have to have discipline. Changes in the junction between the stomach and the esophagus, including abnormal relaxation of the lower esophageal sphincter, can lead to the condition known as.
GERD or gastroesophageal reflux disease.
Yeah, thank you. A blockage of the cystic duct by gallstones is a common cause of inflammation of the gallbladder. What is the medical term for this condition?
Stone, I think it's cholelithiasis.
No, it's
What is for that? Which
the gallstones are called gallstone for me, cholelithiasis. But when you say blockage of the cystic duct, is
cholelithiasis. If it's just inflammation of the gallbladder, it's cholecystitis. So maybe it's choledocholithiasis.
Lithiasis. Let me check. The
Mhm.
answer given by my reference is cholecystitis. Wait lang.
Oh, so maybe it's just asking us for the inflammation of the
Yeah.
gallbladder.
Yeah, inflammation. Yes, the inflammation.
Yes.
Because the condition is inflammation, so cholecystitis.
Cholecystitis.
Condition of having the verticula and the sigmoid colon, which are not inflamed, is
Diverticulosis.
a genetic or environmentally induced lactase deficiency is the cause of which of the following condition?
Lactose insufficiency. Intolerance.
Are tobacco smokers more likely to develop Crohn's disease than non-smokers?
Yes, 10 times as likely.
Twice as likely.
I don't know.
Twice as likely. Twice lang naman. Okay, why is that? Kasi pag sinabi mong Crohn's disease, it involves the large intestine.
Inflammatory response.
So in TZM, the large intestine is connected to the lungs.
Oh,
That's called the metal element. So everybody should know. Okay. So
okay.
if you have lung issues, it can definitely affect your large intestine. Which of the following is a chronic relapsing form of inflammatory bowel disease that causes inflammation and ulcers only in the colon?
Crohn's disease.
Ulcerative colitis. Actually,
Right.
they are discussed at the same time. Kasi one thing with the IBD, ulcerative colitis. The standard treatment for acute appendicitis is
Surgical removal.
lactobacillus is
A probiotic.
the most common cause of a hiatus hernia is
I think it's constipation.
obesity.
Obesity. Oh,
Kaya
sorry.
umakyat yung ano. Gallstones are composed of varying amounts of bilirubin. What other substance?
Cholesterol.
In an ileostomy, which part of the intestine is brought out onto the surface of the skin to allow intestinal waste to pass into an external pouch or bag?
The end of the small intestine, the ileum.
Which of the following is a potential problem to long-term use or high doses of anti-inflammatory drugs such as aspirin, ibuprofen, or naproxen?
Ulcers.
The regurgitation of gastric esophagus, which is the major symptom of gastroesophageal reflux disease, causes the condition commonly known as
Heartburn.
Okay. Which of this is the function of the digestive system?
It will take in and break down food for use by the body.
Good. A long tube that carries food from the mouth to the stomach is?
The esophagus.
Which organ stores the liver's digestive juices until they're eaten by the intestines?
The gallbladder.
An organ that produces a bodily juice called bile is?
The liver.
The place where digested molecules of food, water, and minerals are absorbed is?
The small intestine.
The organ that produces a digestive juice that contains a wide array of enzymes to break down fat, carbohydrate, and protein in food is?
The pancreas.
Which part of the digestive system removes solid waste such as feces from the body?
The large intestine.
Which organ stores swallowed food and liquid, mixes up digestive juices with the food and liquids, and sends it to the small intestine?
The stomach.
Tiny finger-like projections in the small intestine are?
Villi.
Which organ contains tiny glands that produce feces? They just will find in the stomach and small intestine.
The mucosa.
Final portion of the large intestine is?
Is the rectum.
The opening at the end of the digestive tract in which solid waste are eliminated is?
The anus.
Thank you very much, Mom.
Thank you, Doc.
Yeah, so hindi pa nag-aral daw yun, ha? Okay, so yeah, thank you very much, Ma'am Cheryl. Very, very good job. Excellent job. Thank you. Now we go to the reason why we are taking anatomy. So I hope hindi masyadong maingay yung extraneous noise ni Sir Michael. Good evening. We start? Can we talk about the points of the forces now?
Good evening, classmates and doctors.
Very
My
good.
apologies. I tried to replicate myself in the other place. Try to hear in Starbucks, but still the noise is very high.
It's okay. We will just imagine ourselves and adjusting with you.
I still have my friends here. That's why I try to actually have my own answer here, but the problem is the noise. So hope I can join. This is my answer. I brought my laptop also so that I can answer.
What's the point?
But probably I have this issue, very noise.
Okay. Sige po.
Yeah. Well, for number one, point of sea blood for me is the sea of blood is bladder 11, stomach
Ang
37,
galing.
and stomach 39.
Thank you. What is the point of the Sea of Chi?
The sea of chi, for me, my answer is stomach 9.
No.
Si-
Wait.
no?
Basahin mo muna. Meeting point of the governing vessel with the
Ah,
six
It's
yang.
young.
So it should be
Okay.
under in the governing vessel. So what's
Okay.
the point?
Point C of the chi, meeting point of GB with 6 young channels are stomach 9,
No.
CB 17.
He's only
Oh.
answer. What is the
Mm.
point of the GB with the 6 young channels? So the point is not the GB or the do meridian. What is the point?
Oh, that's that's all my answer. I'm sorry for my wrong answer.
Okay. Who can give the correct answer po from the audio, from the panel?
Do 14 daw.
Do 14. Very good. Remember that meeting point of the GV. So nasa GV po. So it should be GV 14 or do 14. Okay.
Okay. Do 14.
Next.
Do 14 po. Meeting point of governor and young thinking vessel is do 14.
No.
Yeah.
Do
Do
15.
15.
Do 15. Do 15.
Yeah, man.
Where do you remember this po? Okay. Burning and young
Point of-
vessels. The point of window of heaven. Soon see me goes from. What is this point?
GB 20.
No.
No? Wala akong
Pang 2.
GB 16.
GB 16. Okay.
The other one, Silmaro.
So how do you needle do 16? Do you go up or do you go down?
Downward.
Downward. Good. Basahin nyo ha. You have to be careful. Baka mamaya you end up with a patient no problem. Okay, Sir Michael, the point of the governing vessel with the bladder, Sanjiao liver channels. This is called the point of the sea of marrow.
GB 20.
GB 20. Very good.
The other one is GB 16. Sorry.
Yeah. Okay. Redeem mo na sarili mo. This one was taken up last time. The front view point of the pericardium.
Then 17.
And gallbladder channel.
Number 17.
So, okay.
Number. Stomach 36.
Kanina, yung nasa leeg.
GB 34.
9.
Stomach 9. Very good. Okay, next.
Number 8. Point of sea, water of vein. Upper stomach 30 and the lower stomach 36.
Point of stomach channel with the chong of penetrating vessels. Stomach 30.
Yeah. Stomach 30 po.
No.
Number 9, point of sea of water green.
The Jose and point of the stomach channel, your very favorite point. It is all
Stomach 36.
stomach.
36 po. Stomach 36.
Lower Jose point of the large intestine.
Okay. Stomach 37.
Galing. Wow. Lower Jose point of the small intestine.
Stomach 39.
Now let's go to the 5 command points. Command point for the abdomen.
Command point for abdomen is stomach 36.
Command point for the back.
You'll be 40.
Command point for the head.
Sige lang. Command point for the head is lung 7. LU 7.
Very good. Yep. So command point for the face.
LI 4.
Command point for the chest.
This is I'm not sure if this is my answer correct. Yeah? Lung 7.
Oh.
No. Is the lung 7? Is it correct?
PC6.
PC6.
This is the answer. Sorry, classmate. Sorry.
Michael, kahit maingay, at least nag-aral ka, may dalawa lang mali. Or tatlo.
Sorry po.
Okay, this is not just knowing the points. It's also about learning how to locate them accurately. Okay, and how to okay, maraming salamat. Enjoy
Awa.
night on a Wednesday. Maraming salamat po. Okay, let's now call on Dr. Mary Angeli Templo of Cagayan de Oro. Good evening, Doctora. Can we take care of... Okay, itong extra points po, we have already given you the notes. So there's no reason why you shouldn't be able to answer this. Okay?
Yes, Doc.
Okay. Actually, I'll give you a clue. Everything is arranged alphabetically. Okay. So obviously, hindi siya word for word kinopia. So you just have to like use your powers to get the answer. Okay, Dr. Templo. Okay, what is
Yes,
the
Doc.
point that's very popular for insomnia, vertigo, headache, palpitations, and mental disorders?
Onion.
Very good. Okay. An extra point. Ito po yung extra point, nakaturo dyan, no? Good for beriberi, toe pain, and when you have redness and swelling on the dorsum of the foot.
It's buffing.
Very good. Sabi ng mga Chinese, bafong. Bafong. Parang
Buffing.
E-N-E. Ano, between E and O. Ewan ko, basta pwede na yung tama. Ito po yung points, Okay. An extra point is very good for infantile malnutrition due to parasites. It's also good for rubella or German measles, eczema, and GI parasitic diseases. This is located above spleen 10.
Spleen 10. Yes.
So what-
It's Baichongwu.
Galing.
Baichongwu.
Ay,
Baichongwu.
parang Chinese si Doktora. So, ba't hindi ko ma-correct yung kanyang pag-pronounce? Kakahiya.
Sorry, Doc, I'm not a Chinese. Okay.
Doktora, what is the extra point? Very good for scrofula, cough, asthma, whooping cough, and neck rigidity.
It's Bailao.
Wow. And lastly,
Bailao.
extra point for numbness and pain in the fingers due to bee pain. So that means painful obstruction syndrome, excessive heat, It's also good for spasm, contracture of fingers, redness and swelling on the dorsum of the hands.
Vaccine.
It means 8 pathogens. Bakit po 8? Pero 4 ang nakikita natin dito. Kasi left. Okay, I know it's a stupid question. Thank you very much, Doctora. We hope
Thank
to
you,
see
Doc.
you in Manila very soon. Thank you.
Yes, po. Thank you.
Okay, let's now call on Sir Darwin Misola. Sir Darwin.
Yes po.
Okay, ready yung boses ha. Again, yung clue alphabetical ha. So, nasa B na tayo. Okay, ano po yung extra point good for rhinitis, nasal,
Bitong.
and nasal boils?
Bitong.
Wow. Ano po yung point? Extra point for paralysis, spasm, contracture of upper extremities, and pain in the forearm.
Besyong. Song.
Okay, bitsum.
Bisyong.
Bitsum. Okay, next. Ito po, very popular po ito, no? It's, in fact, if you have gallstones or, yeah, when you have damp heat in the gallbladder, it's so popular, no? Kung nakikita nyo, it's 1 to 2 tsun below GB34, kung saan yung tender. So, in fact, this is one way of determining kung talagang in pain yung pasyente. Or you might consider doing more tests, no, for the gallbladder. It's also good for muscular atrophy and numbness of the lower extremities. What do you call this point, which is called the gallbladder point?
Danang shwe.
Okay, danang shwe.
Shwe.
Okay, ito naman very popular ito sa mga asthmatic. Everyone should be able to locate this. It's so easy. It's just located, kung nakikita nyo po, 0.5 to 1 tsun, no? Whichever is more tender. From do 14.
C7.
No, where do for
Below. Below C7.
It's asthma, cough, wheezing, clears phlegm, neck rigidity, pain in the shoulder and back, rubella for German measles.
Deng Xuan.
Wow, wala pang mali ah. Okay, another. Okay, nasa ano na tayo? Yeah, what do you call this extra point, which is very popular for hemorrhoids and prolapse of the rectum?
Ervai.
Wow, I'm so proud of all of you. Thank you very much, Sir Darwin. Congratulations. Keep up the good work. Okay, bawal dito magkamali ah. Okay. Next, let's call on Sir Elvis Blones. Okay, anong tawag sa extra point, which is effective for redness, swelling, and pain of the eyes? So the next time you have that, you try to use this point. Febrile disease and also nebula.
Urgian, Doc.
Okay.
Apex.
Okay, yeah, urgent. Okay, ano naman itong point, which is very good for knee pain, weakness of the foot and leg, and paralysis?
Heading, Doc.
Wow. Okay. Ito very popular. Ito gustong-gusto ito gawin ni Dr. Webb, no? Okay. This was named after a very famous Chinese doctor na ayaw niya ng bakshu pero ginamit niya itong points niya. Okay, so it's extends from ano ba to? T1 to L5, no? 0.5, if I'm not mistaken, 0.5 tsun lang yan to 1 tsun. Okay, it treats Wei syndrome due to trauma, lumbar points, treat paralysis of the lower limbs for infantile paralysis, treats intercostal neuralgia, and treats dizziness. What do you call this set of points?
Huwato GRD, Doc.
Wow. Okay, bawal yata dito magkamali. Okay. Okay, so dito nakikita nyo yung point. Which means adjacent to container of fluids. And I think from the illustration, alam nyo na po nasaan, no? Okay, 1 tsun from the midline. Okay. It treats facial pain, deviation of the eyes and mouth. So aside from your favorite points for deviation of the eyes and mouth, you might want to use this. And also facial spasm. What do you call this point? Extra point.
Gia Cheng Jiang.
Galing. Okay. Finally, extra point, very good for pain in the shoulder and arm, paralysis of upper extremities.
Channeling point, Doc.
I'm sorry.
Jian.
Jianchan. Qian. Maraming salamat po, Sir Elvis. Congratulations. So far, wala,
Doc.
nag-aral talaga po kayo. Okay.
Thank you, Doc.
The notes very effective, very
Yes,
helpful,
Doc.
Mary and Mata. Very good. So, maraming salamat po. Now
Thank you,
let's
Doc.
Ma'am Lane Arandia. Ma'am Lane, good evening.
Good evening.
Okay, let's go. What do you call this extra point that treats kidney yang?
Ang sagot ko dito, Dok, Chiaji issue.
No. Okay, bigyan kita ng clue ha. Actually, very like, meron siyang pangalang Jing. Kasi pag sinabi mong kidney yang deficiency, syempre sumasakit yung likod, nanlalamig, at saka malamig yung paa niyan. So, yun. Pain. Okay.
Wait lang.
It's called Jing. Okay, do you want to try? Isa sa, okay, part ang name niya yung Jing. Alam niyo man yung Jing, S. So, Jing Gong. Jing Gong. Okay? So if that's not found in the notes, you might want to Google it. Jing Gong. Okay, another extra point, which is very good for women with irregular periods. O kahit hindi pa nila mens, nagbi-bleed na siya, like mid-cycle bleeding. What do you call this point?
Irregular, po.
Sa J na tayo po, J.
Sagot ko kasi dito sigong eh.
Jing Jong. Jing, tapos ZHONG. Did you get that? Jing, Jing, tapos ZHONG. Chung. Jing Chung. Okay. Number 80. Ito, napaka-popular to. These are actually that are often needled together. No? May isang practitioner sa Hong Kong na very popular. Yun nga lang, magastos kasi you have to see him like twice or 3 times in a day. So that means you have to be like for 1 week, 2 weeks. Napakaganya for neurological conditions. But anyway, dito makikita nyo, it's very good for persistent vomiting, swelling on the tongue, and aphasia with tongue stiffness. So what do you call these 2 extra points?
Type 1 or C-screen.
No. Hindi nyo binasa, no? Binasa nyo ba yung notes? Sino may sagot po dito? Anyone?
Jin
Jin.
Yuyi.
Yeah.
Yuyo.
Jin Yuye.
Yuyi.
Yeah, okay.
Yeah.
Ma'am Lane, basahin mo yung notes. You might want to practice this. Ewan ko kung mag-aalok si Dr. Webb na magtusok niyan. This, kailangan marami kang tissue paper. Okay. Number 19. Yeah, this one is another very good point. Aside from the danang shui, ito naman for appendicitis, intestinal abscesses, indigestion, paralysis of lower limbs. As you can see, it's located tutsun below. Anong point yan? Ma'am Lane.
Landway shui.
Okay, landway shui. Appendicitis. Appendix point. Pag tender yan, actually, okay, siguro in the future we can discuss like how do you do the tests for kung may appendicitis ba, no? Okay. Pero sa ngayon, yan muna. Try nyo i-ano kung tender yan. Okay, number 20. What's your answer here? Point. Luochen. It treats neck or neck pain in the shoulder and arm. So you might want to do this. Of course, you have to use a different kind of needle here. Very, very fine. Maraming salamat, Ma'am Lane. Thank you so much.
Thank you po.
Now let's call on Sir June Azariel. Are you there, Sir June? Mukhang hindi ko nakikita yung pangalan. Nawala yata. Okay. Nawala si Sir June. Maybe we can call on Samsung. Magpakilala ka naman, Miss or Mr. Samsung. Hello po. Sino po si Samsung? Okay. So medyo ano lang ha. We would discourage using ano, unless we know you, no? Parang sign of respect lang. It's okay. Yung iba, kilala na namin, no? Like the very famous Dr. Gavino na masyado pang active until now. Good evening po, Doctor. You have to be ano ha, you have to be on your toes kasi and also we would like to invite you if you are interested to attend scalp acupuncture. Bye. You are very welcome. Excited for April. Dr. Gavino is one of the speakers and it's one moment that you will never forget. Okay? For Paay, maiba muna tayo, matatapos naman tayo eh. We have scheduled 4 different parts for the scalp acupuncture series. So please keep posted for that. It's something that will really enrich your or hone your skills as a practitioner. Scalp acupuncture. There are actually 10. They will teach you 3 out of 10. Okay, so let's go to, thank you po, Ma'am Lane. Let's now go to, okay, who would like to try answering this? Mukhang ayaw sumagot ni Samsung. Okay. Okay, would you like to try, Dr. Mary Angeli? 21? Can you do?
21.
Yeah, 20.
Yes, Doc. Splenomegaly.
Yeah, splenomegaly, jejunal, hepatosplenomegaly, and lumbar pain. Nandyan po yung point.
T-gen.
Wow. Good. P-gen. Okay. A very famous, I don't know kung famous, but an extra point good for infertility and heavy periods. I don't think this is in your notes, but it's in,
I have.
starts with letter Q.
Chimen.
Wow, alam niya. Okay, Chimen. Thank you, Doktora. Mukhang ang dami nyo ng alam. Grabe. Okay. Next, a very good extra point for deviation of the eyes and mouth and ulceration of tongue and mouth.
Jiachengjiang.
Okay. Okay, so ganun pala yung pag-pronounce. Okay, thank you po. And then for eye diseases, another extra point.
Chuho.
Okay, very good. And the last one, okay, Alelia, alam nyo naman po ito, no? Loss of speech due to paralysis of vocal cords, salivation with stiff tongue, sore throat, difficulty swallowing, and loss of voice. What is this extra point, Doktora?
Shang Yanquan.
Okay, thank you very much, Doktora.
Thank you, Doc.
Yeah, thank you. We're excited to meet you in Manila. Very good. Very excited.
Yes po.
We hope
Yes
you
po.
feel the way. Thank you po. Okay,
Thank you, Doc.
let's now go to else pa ba? Ma'am Janine Chan. Ma'am Janine Chan. Good
Good
evening.
evening, Doc.
Okay, what do you call this points? Okay, actually you can use this then for like, very popular, no? Aside from those points that sabi nila, well points, no? You can also use these points. Sichuan. Ay, sorry. What's the name of the point? Nasabi ko tuloy.
Doc,
What's the name of these points here? Nasa tip ng mga fingers. Treat severe heat, lead to loss of consciousness, apoplexy, coma, epilepsy, high fever, acute tonsillitis, infantile convulsion, and numbness of the fingers. What do you call this?
Doc, I got back. See finger webs, Doc. Although it's tip.
No, this is a web. It's just like what you see in the picture. Can you see that? Starts with
The
letter
Mo. Letter, Doc.
letter S. Nasa S na tayo.
Nasa S na tayo.
Do you have an answer?
Sichuan.
Good. Next. For childhood malnutrition, whooping cough.
Saifeng. Saifeng.
Yeah, okay.
Siphon.
Okay.
Sifeng.
Alam na pronounce ito. I'm sure si Dr. Templo knows it. Yung wala natin, she really knows how to pronounce it. I thought it was that easy, but hindi pala siya. Okay, these are actually 4 points surrounding the like nakita from the point called 220, Wansun, sa likod, sa sides, and sa front, no? It's very good for poor memory, headache, vertigo, and insomnia, epilepsy. So what do you call these points? You have to need,
Chishenko.
yeah. I don't know if you pronounce it right. Is it how you pronounce it, Dr. Templo?
Doc Sishan called the same.
Okay. Parang meron yung Google na lang natin yung pronunciation na baka pagtawanan tayo ng mga tao. Because yung the late mom Julie, medyo iba yung pag-pronounce siya dito. But anyway, what's important is you know how to locate points. Next, this one is also very popular. Ma'am Janine.
Dayang. Dayang point.
Great. Good for Shaoyang headache. What 2 channels are involved when we talk about Shaoyang headache? Ano ba yung tinatawag natin ng mga Shaoyang channel? Yung lesser yang channels. The gallbladder and the
Sanjiao.
Sanjiao. Very good. Wow. Eye disorders, dizziness, blurred vision, deviation of eyes and mouth. And number 30. This is good. It starts with, nasa S na tayo, so papunta na ng Z. S, tapos yun. Prolapse of the uterus, dysmenorrhea, abdominal pain, abdominal masses, and myoma.
Tito.
Which means Tito's uterus is prolapsing. Yun yun. Thank you very much, Ma'am Janine. I hope you had fun. Thank you so much.
Thank you, Doc.
Next, we call on Sir V. Ginto.
Yes, Doc.
Okay, sir. Can you tell us anong extra point is good for diabetes, vomiting, abdominal pain, pain in the chest, and hypochondriac region? So, tingnan nyo ha, isang tao mataas yung blood sugar, tapos matigas ang ulo, suka. Siguro dahil sa overeating, kahit mataas ang sugar, saka masakit yung dibdib and hypochondriac region. So what is a very good extra point?
Issue or Weiwan Xia Shu.
Yes, very good. Correct. Okay, next. Ito, very popular din po ito. It's very good for knee pain, but again, before you needle it, make sure na it's really painful, no? So this is parang ashi yung pag-approach natin, but there's a name for this, okay? especially B syndrome, knee pain. So when you say B syndrome, there is that's painful obstruction syndrome caused by pathogenic factors like wind, cold, and damp. So as a good practitioner, you should know the differences, no? Ano yung caused by cold, caused by dampness, caused by wind, and caused by heat. Okay, so weakness also of the lower extremities. What do you call this point? Cervix.
Sian.
Okay. Yes, very good. Okay, number 33. Yan dyan po yung point. Treat seizures, epilepsy, headache, insomnia, and constipation.
Yao Chi.
Very good. So I hope everybody got that. Okay, this one is very popular. Try doing this, but you have to use a different kind of needle, no? Ibang klaseng needle ginagamit dito para hindi masakit. It treats low back pain and acute lumbar sprain.
Yao Tong Dian or Yao Tong Shui.
Wow, congratulations. Very good. Wala pang mali. And finally, for number 35, we use this for sore and weak low back due to kidney yang deficiency. Madali lang po pag kidney yang deficiency. Malamig yung paa, you know, minsan natatai pagising like 5 a.m., no? Frequent urination, irregular menstruation. In other words, kulang sa kidney yang. So what is the extra point?
Yiming.
No.
Yiming.
Hindi yan. Iba. Could you give it time? Before starts with Y pa rin, pero hindi. Is that found in the notes?
Yao yan.
Yao yang guan.
Yao guan.
Yao yang guan.
One.
Yao yan po. Lumbar eye.
Notes, di ba? Okay. Thank you very much, Sir Vic. Very good job.
Thank you, Doc.
Thank you. Keep up the good work. Now we'll call on the last ones. Ma'am Darlene, are you still there? Ma'am Darlene, Federico?
Yes po, Doc.
Very good.
Good evening po.
Okay, ito, napaka-effective po nito.
Yao yan yan.
Okay, what do you call this extra point, which is very good for myopia? You know what's myopia? Nearsightedness. And also eye diseases. Good for insomnia and tinnitus. Hindi po siya GB20. So parang malayo-layo. Okay.
Ito po yung Yiming.
Yeah, Yiming.
Yiming. Sorry. Yiming po.
Very good. Ito naman, very popular. In fact, we use this as like yung mga tao
Face.
agad yung ito. Ito po ang nakakaano. It treats post seizures to calm the mind, frontal headaches, infantile convulsions, nasal discharge, but we partner it with LI20 or PTOM, diba? Treats forgetfulness and dizziness, o diba? Very effective. Ang daming uses. Chronic and acute childhood fright, fright spasm, frontal headache, dizziness following childbirth, insomnia, agitation and restlessness, nasal congestion and discharge, rhinitis, nosebleed, disorders of the eyes, hypertension, and pain of the face. So it's more of pangpakalma. What do you call this very famous point? Extra point.
Yes po, Doc. Ano po? Yintang po, Doc.
Okay. Yung mga Chinese, they pronounce it as intang. They don't
Intang.
the Y. Parang I lang din. So parang intang, no?
Intang. May experience po ako dito, Doc, na hindi ko makakalimutan, Doc.
I'm sure excited.
Intang.
Malapit naman tayo. Okay.
Sige po. Ano po, kasi i-share ko lang, nagulat din ako, hindi ko alam kung anong gagawin ko dun, Doc. Depression siya, pero nilagyan ko siya ng yintang. Nung tinanggal ko po yung karayom, yung dumugo po as in dugo na Kaya,
Hindi ka naman natakot.
yun lang po. Medyo natakot po ako kasi wala naman po akong alam na ano. Pero, nag-ano po siya eh, nakaginhawa daw po siya.
Okay.
Pero, wala po akong kasing experience.
Kaya nga ano,
Yun lang.
time you remove needles, dapat may nakaabang ka na dry cotton, no? Especially yung mga tao na parang may empty heat. Yung may talagang, mararamdaman mo mabilis yung pulso. Empty heat or excess heat, talagang may heat in the blood sila. So you should be prepared, especially yung mga mainitin ng ulo and masumasakit. And usually pag stress ang tao, talagang mag-expect ka may lalabas sa tubo. And it's very, very effective. So natuwa naman yung pasyente, Ma'am Darlene.
Hindi po nga siya ako po yung natakot. Eh, kasi para siya nag-drip na faucet, pero nakaginhawa daw po siya, Dok. So, sabi ko, ano ba to? So, pero yun, Dok. Yun yung ano niya.
Yeah, next time,
Yung feedback niya.
yeah, yung dila, kung walang coating or masyadong makapal yung coat, tapos yellow na yung coat, feel mo yung pulse, so definitely may heat. And that's one way of really releasing the heat. So, yun.
Napakasarap daw ng pakiramdam niya, Dok eh.
Okay. Very good. Congratulations. Pero dapat siguro kayo rin dapat ni Yintang, no? Kasi parang... Okay, continue natin, Ma'am Darlene.
Yes po. Yes po.
This one is so popular, I tell you. This is part of our LAM protocol for acupuncture on the face, no? Facial.
Yes po.
Most of them would always report, bakit nag-improve yung eyesight ko? It's really true. Lumilinaw. But again, you have to caution the patient that this is going to be painful. Why? Kasi may mga ano dyan, definitely since may kilay pa, medyo masakit yan kasi most likely talagang maano mo yung hair follicle, no? And also we have a lot of nerves there, very sensitive. So you need to pull the skin up or use a very fine needle, very small, very Okay, I'll let you know about the needle that I use and as long as comfortable yung patient. And again, if merong liver blood deficiency or liver yin deficiency, magkakaroon siya ng bleeding. Kaya be ready with your cotton. Okay? So it treats blurry vision due to liver blood deficiency, incomplete closing of the eye, and also when you have frontal headache. What is your answer here?
Yuyaw po.
Very good. Yu Yao. Number 39. Okay.
38.
It's very good for nausea, vomiting, and hiccup.
Song
Chongqui. Chongqui.
Chongqui. Opo.
Finally, andito na po tayo sa last. It's very good for infertility. This is where the points are located. Uterine prolapse and abdominal masses.
Sigong.
Yeah, Sigong Shui.
Sigong.
Congratulations po, Ma'am Darlene. Thank you everyone for
Thank
joining.
you po.
And we hope you had great fun. You're almost... Bakit kitang-kita to yung aking mga sekreto dito? Wait lang. Bakit ayaw mag-work? Okay, anyway. Okay, anyway. Thank you, everyone. Did the notes help?
Yes, Doc.
Okay.
Yes, Doc.
Dami na ng notes si Doktora. Oh, I'm sure na-memorize na lahat yan. We hope that your journey with us is going to be memorable. Ang layunin lang naman namin is to give you what we can because this is how the pioneer of acupuncture wanted it, si Dr. Lilia Marquez Palanca, no? So, of which the foundation was named after. We would like to thank everyone for your support. We're not making paalam yet. And we're very happy that you all had the time to really study. And I hope everyone has received their, yung week 8. Okay? That's for urinary system. Then this will be followed by the reproductive and the lymphatic system. Definitely wala tayong Zoom sa last week. So our last week 10 will be on the first week of April. Okay, Holy Week po ang March. Oo, kasi kung mamimit tayo ng Holy Wednesday na po 'yan. Kung gusto niyo mag-meet, kaya lang wag na lang muna, no? Magdasal muna. So, pagpahinga rin kayo and I'm sure na exhaust. So after this module, maghihiwalay na po ang 1 sa 2. For those who are with batch 2, we will start with TCM foundations. We will use the same approach. We'll give you a lot of questions and of course new notes. And for batch 1, you are about to finish. This will be your last module. Ito po yung tinatawag nating clinical or yung treatment principles, no? Of course, we are very proud of all of you for reaching this far. Ang bilis ng panahon, no? And we hope that second batch will be motivated to see all of you performing what is expected of you, no? So ganyan po tayo, tiyaga-tiyaga lang, and we're happy that we like our system. We would have wanted you to really read on your own. This is what we call independent learning. We don't do spoon feeding here. We also have the videos on YouTube. So sa dami medyo hindi nyo, pero maiikli lang po yun. So it's up for you to naka naman yun, naka-album, no? So depende sa kung ano yung gusto niyo matutunan. So do we have any questions before we go? Okay, wala. So okay lang po sa inyo, next Wednesday yung meet natin. And that would be like, if I'm not mistaken, you will have 2 days of the practicum with Dr. Webb. Will it not be in conflict with your Okay lang naman, di ba? Oo, so hanggang dito po, kasama yata ito, no?
Tomorrow po meron kaming class with Doc Webb po.
Yeah, meron po kayong, lecture. Okay, so anyway, so next Wednesday we meet again. Thank you very much, everyone. Happy studying. Thank you all.
Thank you po, Doc.
To mention all of you, and thank you so much for your excellent job, excellent performance. Good night, everyone. See you next
night.
time. Good night.
Good night.
Good night.
Salamat po.
Good night, Doc. Doc, follow up lang yung email. Wala pa.
Wala pa.
Yes, wala pa po.
Yes, Doc. Wala.
Oh my God. Okay. Sumakit yung ulo ko, Sabi niya kasi, give it a Sunday pa. Okay. Ano pa nangyari? Sige.
Busy si Doc Abet.
Ano ba yan? Sunday ko pa pinadala. Okay. Sige po. I'll make kulit. Or I'll probably, siguro you just, paano ba? How do you connect? I don't have your email addresses kasi. Anyway, sige, I'll make a follow-up kasi I'm sure all of you would like to start answering them now. It will be all about urinary system. Meron din tayong in-include na massage therapy. And I'm sure some of you might be putting up their own spa. And most likely you'll be getting licensed massage therapists. So, di ba, importante din mayroon tayong alam sa massage. And kung ilang square feet yung kailangan for your no? For those who are entrepreneurial, no? It's always good to combine these things like massage and okay, so with that, sige, I'll make kulit po. Thank you for kaya pala walang. Okay, sige po. Maraming salamat.
Thank you, Doc.
Thank you, Doc.
Thank you so much. See you next week.
Bye, everybody.
Bye-bye po.
Thanks, Doc.
Bye.
Good night.